The CDC has estimated that excessive alcohol use results in over 95,000 lives lost in the United States each year. That's over 260 lives per day, or 10 lives per hour. Our guest on this week's Health Talk is going to discuss alcohol use disorder and the importance of understanding the impact of alcohol on one's health. So please stay tuned for this important show. Health Talk is up next. Hello, I'm Dr. Eric Mazer. On this week's Health Talk, we're going to discuss the prevalence and the impact of alcohol use disorder. My guest is Dr. Stephen Strong, an internist with Internal Medicine Associates of Westport. Stephen, welcome to the show.
Thank you, Eric.
Welcome to Westport Internal Medicine Associates and New Vance Health. Good to have you here.
Thank you, Eric.
So you're an internal medicine doc,
Yes.
right? Alcohol use, I know in training, well, we both trained in internal medicine. I've often half facetiously said if it weren't for the complications of alcoholism, I wouldn't have enough inpatients to practice on. So we know this is a common problem. Tell us a little bit of how widespread is it? We often saw it in the context of the indigent, but I know it's quite prevalent even in the middle class and upper middle. Tell us about the extent of the problem.
Yes, I think I wanted to bring this topic up, especially now because of the COVID pandemic, because of course, with a lot of the lockdowns and everything that happened last year, especially, there's been so much pressure on everybody and stress of being at home. So I've seen a lot more alcohol use creep up into more.
You've actually seen this in your practice?
Yes, absolutely. Here, in the area, just in general, because people have been under more stress and, having had to work remotely from home or having had more financial problems, they've been, seeking alcohol as a treatment option for them at home. And so we've been seeing a lot more alcohol use disorder creep up in patients, just, lay people in the community in general.
Well, I know I can certainly speak to the stress myself. It's just, I think a lot of people don't say, well, no, that's everybody else, but it's fine. But I know that even, with family members, just we get on each other's nerves more than we used to.
Absolutely.
Because we've been stuck, and I know things are getting better now, but
finally, yes.
It's really been a problem, and we've underestimated that impact of the whole epidemic, haven't we?
Yes, definitely. I think, especially like last March, April, May, I think a lot of people were home and there was nothing else to do, and they were with their spouse who worked from home as well, and it was almost popular to just be daily drinking at that point. It was like on the internet, on Instagram, TikTok, whatever it may be, people were just drinking every day, and it really has led to some serious problems.
So tell us, well, drinking is a part of our culture, and we tried to ban it back in the 20s without with a devastating, or I should say, certainly a problem. So it is part of our culture, like it or not. When does drinking become problematic? And I maybe could also even address, we know a little bit of drinking is actually beneficial when you look at lifespan. So
Yes.
tell us, when do we say alcohol is a problem for me? When are the signals that somebody should say, hey, there's a problem, something's gone wrong?
Very good question. So you're right. Alcohol use is actually in many ways healthy in many circumstances, because it can reduce the risk of coronary artery disease, which is of course the #1 cause of death in humans. So, moderate drinking can reduce the risk of early death in some cases, and obviously it can help you relax, and there are many positive social aspects of it. However, as you highlighted, it is hard sometimes to define the line at which it becomes a problem, but usually it starts to become a problem when alcohol starts to interfere with your function in life, your daily function in life, and starts to become something that controls you as opposed to you controlling it. So, for example, if you were one who was spending more time preoccupied by alcohol use, and to the point where it was interfering from your work hours, where you were actually getting in trouble with your boss because you were working fewer hours because of alcohol, that could be a clinical problem from alcohol use. Or, for example, if you were drinking and waking up later than usual because of the fact that you were hungover the next day and you missed an appointment or you missed some sort of important function on a regular basis, that could be a sign that it's impacting your life too much in a negative way.
So there's not a strict cutoff. I know for some of the survival curves, and please correct me if I'm wrong, I recall seeing 1 to 2 drinks a day was sort of in the good range, and then you didn't get any benefit after that, and life expectancy started to get shorter when you went over that. Is that right as far as your understanding?
There definitely is a sweet spot. So, for example, I think even certain types of cancers, there's an increased incidence in people who drink zero alcohol, similar to those who drink too much alcohol, but people that drink a moderate amount may be kind of in the sweet spot. And I think it is something around between 1 and 2 drinks per day on average for
not that we're necessarily promoting alcohol
right.
use.
Exactly. It wouldn't be a recommended treatment option or prevention option, but there are some benefits at that level.
But the actual somebody who comes home, again, it's not part of my culture, but some cultures, people may come home and have 4 beers between dinner and bedtime. Is that bad, good? Does it make? I mean, it's over that number, but
right. I mean, on a here and there basis, that's probably pushing it, but could potentially be okay. Of course, there's also a lot of calories in alcohol too, so that can add up as well. So you can easily gain weight from drinking too much alcohol. And the recommended daily amount is sort of something around like 10 to 14 drinks for men per 1 7-day period. So that would be on average 2 per day. So that guideline is sort of has changed over time and probably will change again. So it's kind of depends on the current science. And
are the guidelines for women different?
Women is 7 per week, which is a lot fewer. So that would be on average 1 per
We
day.
understand. Is that just because of body mass differences, or is it?
I think it's partially
metabolically different.
I think it's metabolically. There's a different like fat content in women, so they metabolism alcohol differently, and then they also have an increased risk for breast cancer, which is more sensitive to alcohol use than some male cancers are. So I think it's a combination of like metabolic and endocrine sort of, and also body size related concerns.
That's especially the breast cancer. A lot of people think of smoking and lung cancer and don't realize the vast number of cancers it can cause. And I know alcohol can be synergistic with a number of those cancers as well. So how do you, as an internist who sees patients in every walk of life, how do you screen for alcohol use disorder, and what kind of receptivity do you get from your patients?
That's a good question. I find that sometimes when you're meeting a patient for the first time, it can be more difficult than if you know a patient more, better. There are some validated screening tools that exist, and one of them would be, for example, to ask patients if in the past year they've had for men more than 5 drinks in one period. That just screens patients for being more at risk for having an alcohol disorder as opposed to not. So that would be one option. But also you can just ask patients, tell me more about your alcohol use, and then oftentimes they'll go from there. And just shutting up and listening is a good place to start. And but it is important to ask that question because I'm oftentimes surprised.
Yeah, because some people can function and drink excessively.
Right, exactly, totally. And many people may be very healthy in a lot of ways, and they may be functioning very highly in society, but also have this problem. And
is that okay? Let me throw that out to you, because again, I know statistically, in terms of number of drinks a day, it probably isn't.
Right.
But if they're a compensated, I don't want to say alcoholic, but compensated excessive drinker, what is that bad?
It's not great, but I mean there are worse things, and I think with each patient, there are certainly compromises that we make in our lives in terms of what our goals are. So for some people, that may be acceptably abnormal for them, and it may be the case that they don't have severe liver abnormalities. It may be the case that they don't have any other problems, and that may be something that they are willing to tolerate the risk from. So it's sort of a conversation, but oftentimes it may be there, but it could also get worse from there as well. So
let me ask the question a different way. Can somebody be drinking so much that it does lead to chronic liver disease, but be compensated behaviorally? I mean, do you ever see somebody who says, "Oh, yes, I do. I drink. I drink it at the office at the end of the day. I have 2 drinks before dinner. I have a couple more after dinner. But I feel fine. I'm making a good living. My family life is intact." But then you go and find out that they have cirrhosis.
It does happen, absolutely. And oftentimes it's when people have undiagnosed comorbid liver abnormalities, whether it's, for example, hemochromatosis they didn't know about, or alpha-1 antitrypsin disorder, or non-alcoholic fatty liver disease.
And I'll speak as a hematologist, and I know we're throwing around terms. Hemochromatosis is a pretty common diagnosis,
right.
Especially heterozygous. It's not really hemochromatosis necessarily, depends on the gene. But seeing people with iron overload problems, and because alcohol exacerbates that iron overload too.
Correct. So you're right. So a lot of times they won't have known about this. Maybe they're adopted, they don't have a family history, or even non-alcoholic fatty liver disease, which is quite prevalent. They may not be diagnosed, and then they just end up with liver damage that they wouldn't have otherwise known about.
So it is important, again, to see your doctor, and you're not going to know about this if you think you're behaving okay and your life is going okay, but you do have perhaps an excessive alcohol intake compared to the recommended.
Right.
It's important to see your doctor.
It's good to be checked out because even blood work can show up a lot of, can give you a lot of information. And oftentimes even just an ultrasound can give you a lot of information about the liver's health as well.
And I've actually seen some data recently that for hemochromatosis at least, and I don't know if this is true for liver, for alcohol, that some of the even cirrhotic changes can be reversed by removing the iron. So, again, there's things we can, I guess the point is, there are things we can do about this before it becomes end stage.
And the liver is extremely regenerative. Of all the organs that can be damaged, that can fix themselves, the liver is probably the best at that. So that is the good news.
Yeah, that's actually great. Now, I did want to ask you about kids. I mean, I don't mean 6-year-old kids, I mean teenagers and adolescents. So, when these kids binge drink, or they're in college who are, where it's almost a badge of honor when you can put away 10 beers in a night.
Right.
How does that relate? Is that an alcohol use disorder? Is it immaturity only? Does it predict alcohol problems in the future? How does this fit into what we're discussing in the sort of the stable, mature adult population?
That's a good question. I think the culture around alcohol use in the college setting is not great because it's probably healthier to drink more frequently at smaller amounts as opposed to binge drinking all at once in heavy amounts for several reasons. I think it's probably immaturity too. It's not always going to translate to a problem in the future. But unfortunately, a lot of bad things can happen when you really binge drink because you can have an accident, you can easily pass out, and people have died from that type of exposure.
Yeah, I will actually speak. There is I don't know how much information to give. There's a person in this community who had a grown son at a fraternity party where they got drunk and they had a spitting contest off a balcony. And unfortunately, he ran off the balcony. He tripped off the balcony. It was a couple of floors, but he died.
Right.
So, as you said, or accidents. I remember in college getting on the highway going, and I wasn't driving, but I was with some people who were drunk, getting on the highway going in the wrong direction. So these are really awful, dangerous, and completely preventable things.
Right. I mean, I would say definitely most people that are in college that binge drink on occasion probably will end up fine without a problem in health, physically and mentally in the future. So generally speaking, it's not a huge deal per se, but it can definitely run into problems.
Are people using the designated driver more? That seems to be have less of a I'm blanking on the word, but stigma attached to it than it used to. I mean, because sort of in the old days, that, oh, you're not drinking, that it was sort of a poo-poo, and there was a certain, again, I'm thinking about my own adolescence.
Right.
There was certain macho-ness about driving when you were drunk. It seems to be more people recognize that that's just stupid.
Yeah, I think you're right. I think the stakes are higher.
Not to be blunt with the words.
I think you're right. And also Uber has, and all the other Lyft, like driving services now, it makes it a lot easier to just all go without having to worry about a driver. But I think that there's more, there's like less, the police are less likely to just let it pass or let it slide than they maybe, I guess, potentially used to be, and there's more checkpoints and things like that. So it's just, maybe that's part of it too.
Well, that's very, and advice you can give parents about if kids black out on the weekends, if they regularly get sick afterwards, alcohol, do you see alcohol withdrawal seizures in this population at all?
Sometimes, rarely, but it does happen. I've seen it more when I was in my training, when I was in inpatient medicine, because we would be seeing hospitalized patients with alcohol use. But that is always a life-threatening emergency, so that has to, that's very serious. But if kids were to be, if a parent was having a child who was drinking too much, it's probably something that's best addressed by having that adolescent be, seeing a doctor that knows about this stuff, because it can be tough to tease out whether it's going to be more serious or not.
Yeah, because it seems like a rite of passage. And
right.
Anyway, unfortunately, we could talk about this all day, but we've run out of time. I really want to thank my guest, Dr. Stephen Strong, for joining me on Health Talk today, and thank you for watching. Please share your questions and comments with us at healthtalk@nuvancehealth.org. We'd love to hear from you. We'll see you next week on Health Talk.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
Alcohol is a major personal and public health problem in the U.S. The over 95,000 deaths annually from alcoholism translate to the loss of an estimated 2.8 million years of potential life. Our guest on this week's Health Talk will discuss the prevention and treatment for alcohol use disorder. So please stay tuned for this important show. Health Talk is up next. Hello, I'm Dr. Eric Mazer. On this week's Health Talk, we're going to discuss alcohol use disorder, its prevention and treatment. My guest is Dr. Stephen Strong. He's an internist with the Internal Medicine Associates of Westport. Stephen, thank you for joining me on the set today.
Thank you, Eric.
I know you do general internal medicine, but this is an interest of yours, and it's certainly something that's not uncommon in our civilization.
Correct.
So maybe just briefly define what alcohol use disorder is, and then we'd like to get into how do we prevent it and how do we treat it.
Right. So alcohol use disorder is, simply spoken, a condition where alcohol use interferes and causes problems in people's physical and mental health. For example, when it interferes with their responsibilities in society or causes other harm within their body.
So if you're fighting with your spouse about alcohol use, it's probably a problem.
Probably a problem.
Or if you, as you said, if you're sleeping late and missing an appointment, it's probably a problem. Sleeping
Correct.
late because of the alcohol.
Correct.
So let's start with prevention. I haven't heard much about prevention. Are there certain people you can identify that are more at risk for this than others? And are there strategies you can take to make sure it doesn't become a problem?
Yes, there are certainly some prevention and risk stratification ways for people. Certainly men are more at risk for alcohol use disorder than women. Also, people with relatives who have alcohol use disorder are more at risk because there are some genetic components as well.
Yeah, I was going to get to that. I think that's important. So this is not just all behavioral, although I guess it's, do we know there are any specific genes that are associated with this, or is it more that that my father had it and therefore I learned from him and then I'm sort of susceptible?
I think that's still being teased out, but certainly there's definitely a genetic component to it, absolutely. In the way that people's brains process alcohol related to opioid receptors in the brain, there's a lot of genetic predisposition that one may have to become addicted to alcohol as opposed to somebody else.
Yeah, it's certainly in my own experience, and I just never really enjoyed getting really drunk.
Right.
It never tickled the right receptors for me. So it was almost unpleasant once I got over that slight buzz. So it was never a temptation. But I know there are a lot of people that really, somehow they're getting a very positive feedback from being very drunk. And it must be a different, as you said, in our receptors and the way we process alcohol.
Exactly. So the main difference is for you and me, people that don't have alcohol use problems, when we drink we get buzzed or we feel relaxed, and that's a nice feeling, and that's sort of the end of it. You'll have a couple drinks and then you'll feel relaxed. But for some people who have a problem, their brain also triggers the reward cycle pathway, which is similar to opioids. And so that causes their brain to want more and more and more beyond the point where most people would just say that's enough. And that's sort of where the difference is between people with alcohol use disorder and people who just drink alcohol normally, in a sense.
So can someone say, how does someone identify that they're at risk? What are they sensing?
Right.
I think you've answered this question in part, but are there anything else that would be helpful?
I think that if you're somebody who drinks a couple drinks and then has a really hard time putting it down and ends up having had a lot more than you planned on having, that's usually a pretty red flag. Or like you said, if your spouse is bringing it up on a regular basis. Most people that have a problem with alcohol, it's usually pretty clear to that person, but they maybe have a hard time admitting it, but it's usually kind of understood within their own self.
Okay, so And family history, I know you mentioned that too. Would you say a little bit more about, because it seems to me that that works against you both ways. You may have
Yeah.
the genetic predisposition, and then you have the psychological trauma that that sort of induces you to drink, and the role modeling, if you will.
Right. I think you're right. And I think a lot of times people who grow up in a family with a lot of alcohol maybe are exposed to alcohol at an earlier age, and that has been shown to be associated with the development of alcohol use problems. So there's that.
Let me stop you there, because that's, I know the French give wine to their kids.
Right.
And yet my understanding is alcoholism is no worse a problem there.
Correct.
Is it, why? Why,
Yeah.
if early exposure,
I think that's a good question. I think I was earlier talking a little bit about the culture of alcohol in different societies. Like I think in France and other countries in Europe, it seems like they drink more in moderation on a more regular basis, which is like less binge drinking, and that might be better for the, maybe that doesn't put you as much at risk for alcohol use disorder. So perhaps it's just the stigma in some cases here that makes people drink more than they are supposed to at earlier ages.
yeah, I wonder, I don't know the answer to this.
I don't
You may
know.
not either. I wonder if the binge drinking that we see at college campuses, the weekend drunkenness that is so much of the adolescent young adult culture, I wonder if that's true in the European campuses. Do you have any idea?
I don't know. I think in the United Kingdom it's pretty similar to here in the sense that I think they do a lot of really big binge drinking on the weekends. I think in France and certainly in France and Germany from my time there when I was traveling, it seemed like they were more likely not to be quite as much binge drinking as they were in other places. But I'm not sure about that.
Yeah, so it's interesting whether some of this is, how many, this is always the issue, is called,
Right.
Nature and nurture, but,
Right.
Is there something about the British genes or the Irish genes, of course, that become a cliche,
Right.
that leads one towards, or is it really just a cultural thing?
Yeah, it's a good question. I don't know.
But we're learning more about this all the time. Okay, so you want to identify yourself at risk, and I guess that's, if you've already answered that. If you have somebody that does come into your office, admits to being a heavy drinker, to have an alcohol use problem, how do you go about treating them?
That's a good question. So there's a couple of options. There's like medication, there's medication options and there's non-medication options for treatment. So oftentimes there may be like an underlying anxiety disorder that may be contributing to alcohol use. So identifying and treating that is a good first start. Depending on the patient's ability to, depending on what they want to do, there are 12-step programs. You may have heard of AA, for example, that can be very helpful for patients. But as an internist and as a prescribing doctor, oftentimes I also help patients out with medical management of alcohol use disorder with naltrexone, which is a medication that we sometimes use for alcohol.
Which is a very interesting medicine. They could spend a few. Why does that work?
Right. So I was mentioning earlier how that when you drink, you get buzzed, which is sort of the GABA pathway, which is a neurotransmitter called GABA, and that makes people feel relaxed, and that's sort of normal. But people that have alcohol use disorder may also trigger the reward cycle pathway in the brain, which is a different chemical transmitter altogether. And naltrexone decouples that reward cycle system in the brain so that when you drink alcohol, you don't have the reward cycle triggered and you drink less alcohol.
And there's some chemical similarity between naltrexone and opioids, correct?
Yes, correct. So it prevents the mu opioid receptor, which is triggered in people with alcohol use disorder.
Which is really, because you can use that for opioid issues.
Opioids, and even also obesity for eating addictions, I guess you could say. So it works on a lot of different types of addictions.
Is that the first medicine out of the case that you use for alcohol use disorder?
It is the most effective, now it is, yes, these days. There's a lot more evidence that show that it is the best option and the most effective, the least likely to cause side effects and problems, and it really works well.
Yeah, because I remember from the olden days, just to mention it, there was a drug we used called Antabuse that,
Right.
but it had a totally different mechanism of action. It made, what it did is if you drank, it made you sick as a dog.
Right.
So it was really negative conditioning, but it was
Yes.
it wasn't a particularly, I don't know, it was not a great drug to sell to patients.
Correct.
Here, if you go wrong, if you step off the pathway, it's going to make you sick as a dog. It was just not a particularly good drug. Do you still use that, or is that pretty much out of?
It's still used, but it does have a lot of drawbacks. Certain patients who have a lot of motivation, who really just don't want to even have a sip of alcohol, they can use it successfully. But it's not as helpful as sometimes naltrexone because it just has problems, like you said.
And how long is the period of withdrawal? And do you ever have to use, I don't want to get too medical, but there are certain, some of these benzodiazepines,
Right.
which actually stimulate the GABA receptor to sort of bridge the time between alcohol and your body adapting to the absence of alcohol. Do you ever use those as part of that bridge? And
Yeah, certainly sometimes it can be very unpredictable who's going to have alcohol withdrawal. If you're drinking intermittently throughout the week, you're probably not going to have alcohol withdrawal. But if you drink every single day for years, you probably are going to have alcohol withdrawal. So yes, it can be dangerous though. So sometimes
alcohol withdrawal can be very dangerous.
Exactly. So if you're not sure, it's probably best for that person to be in the hospital for withdrawal unless you have a lot of experience. I have some experience with withdrawal in the outpatient setting, but it can be a little bit dangerous. But gabapentin can actually be used,
Oh, really?
which is a bit safer than benzodiazepines like lorazepam or Xanax, for example, and that can be safer.
Interesting. And how long is the period of time on naloxone until you say, okay, now
Right.
you are off the drug,
Right.
we're going to withdraw the medicine? Is naloxone forever, or is it a...
Yeah, so sometimes people take naltrexone or naloxone, because you can also do Vivitrol, which is the injection form. But oftentimes it can be for 6 months or 3 months or 6 years. It could be forever. It really depends on the patient. But it can be a long-term treatment.
And the other thing that I guess is out there, and I really have no idea the answer to this, I think AA preaches this. If you have an alcohol use disorder, can you ever go back to sort of drinking socially, drinking normally, or is it you can't have a drink before dinner because that's going to trigger everything negative, and you're going to be back back, what is it, on the wagon or off the wagon?
Off the wagon, yeah. Certainly some people can resume drinking normally after they've been treated for alcohol use disorder. I would say most people can't, but some people can. Naltrexone does allow people to drink more normally, even in social settings.
So you take naltrexone
and you still drink, exactly. So that's what's nice about it. You can still just drink, and then you just drink more normally as opposed to abnormally, and then you can have a more normal life. So that is one of the benefits of naltrexone.
Interesting. Naltrexone has any negative side effects?
Typically, no. It can. One of the main ones is you can't take opioids when you're on.
I was just going to suggest that. So if you're having major surgery,
Right,
it may not be the drug.
May not be the best drug for that. Or yeah, exactly. You should let the emergency room know if you're in for a broken leg that you're on it, because you're going to have higher doses of opioids. Nausea sometimes. Sometimes depression. It can actually sometimes cause mild depression, but usually drinking less alcohol improves depression, so it's usually a net improvement. But typically very few side effects.
And we were talking during the break, maybe we should say something about this. Someone is a regular drinker, so they're drinking every day, and they break their hip and they come in for surgery.
Oh, right.
Why they absolutely should mention something to the surgeon, to their doctors about the regular alcohol use. It could save their life. Why don't you say something about that?
Yes, oftentimes alcohol withdrawal is a risk for those patients, and if you have alcohol withdrawal in the hospital and it's not recognized early enough, you could have withdrawal seizures. You could have blood pressure elevations that could be potentially fatal. So it's very important to bring that up.
Yeah, delirium tremens.
Delirium tremens would be the worst case scenario.
The worst case scenario of alcohol withdrawal.
Yeah.
And I think we've all seen it in our training. People that come into the hospital, they are closet drinkers. They don't mention it to anyone. I've seen this actually even in I mean, we used to joke about it, but the little old ladies who you would never suspect of drinking, and they come in and a few days into it, they have a fever, they're beginning to twitch, they may seize, their blood pressure goes up, and lo and behold, they're sick. They're in significant problems. So, so it doesn't matter how embarrassing, something you have to mention.
Yes.
Because we can manage it, right?
Exactly. It's fortunately very easy to relatively easy to manage with the right medications.
Right. So it doesn't necessarily mean giving you drinks in the hospital.
Right.
Although I think sometimes they'll even do that.
Yeah, that's true. Luckily now we have good medications that work just as well.
Right.
So, but you're right.
But this is so helpful because this is an important issue in our society, and there are a lot of things we can do about it. And again, we're not going to outlaw alcohol. We're probably never going to get college parties to be alcohol-free, but we have to use common sense.
Correct.
And you certainly don't want to die of alcohol-related disease, and there are enough of them out there. And unfortunately, we have run out of time. I really want to thank my guest, Dr. Stephen Strong, for joining me on Health Talk today. And thank you for watching. Please share your questions and comments with us at healthtalk@newvancehealth.org. We'd love to hear from you. I'll see you next week on Health Talk. And remember, drink responsibly. And if you think you may have a problem, please see somebody. There's so much we can do about it.
forward together. Learn more at coronavirus.gov.